Dr. Danish Ali is back with us again here on The Factor Uncensored to talk about a topic that many people are talking about. The average person is out there talking about. Now, many of them are shocked that they're hearing from the Surgeon General that alcohol can cause cancer. That's nothing new. What he wants to do is put labels, right, on alcohol saying that it can cause cancer.
That's correct, Isaiah. Alcohol is the third leading cause of preventable cancer in the United States. There's been over 100,000 cases of this annually associated with cancer and alcohol, and 20,000 deaths that are associated annually in the United States. And so the Surgeon General wants to bring it to the attention of American folks that, listen, there is a significantly higher chances of developing cancer associated with alcohol use.
Now, what kind of cancers can you get as a result of alcohol use or abuse? And is it just use or abuse?
Yeah, so we know, Isaiah, that alcohol damages cells and DNA, and so there are many different cancers that you can get. Just to name a few, Isaiah: breast cancer, prostate cancer, you can get cancer of the esophagus, neck, head cancer, and also, most specifically, colorectal cancer and liver cancer as well. So these are just to name a few, but again, it causes cell damage, and those cells are all over our body, and so it increases the risk of many different types of cancers. And unfortunately, especially if you have a history of other medical comorbidities, or if you actively smoke, those will even increase your chances even further. And that's where we're seeing these high number of cases that are associated with cancer, specifically alcohol use.
There was a time when we used to hear a lot about this, Dr. Ali. They said the abuse of alcohol could lead to cirrhosis of the liver. You rarely hear that anymore. Is that considered one of the cancers, or is that something totally different?
That's different, Isaiah. So liver cirrhosis can also happen as consumption of alcohol, and that we still do see. What we're seeing and associating even more is the associated risk with cancers, specifically liver cancers as well. So we're seeing hepatocellular cancers and even stomach cancers associated with that, and all the other ones that I've mentioned. So yes, liver cirrhosis is 100% still there, and yes, we're still seeing that. On top of that, we're seeing the cancers that we're discussing right now.
All right, Dr. Danish Ali, Archpoint Pain Institute, we appreciate your time. Thank you for joining us, and thank you all for joining us here on The Factor. We'll be back after this commercial break. Don't go anywhere.